What does informed consent for Ambien look like? My name is Dr. Ruth Dutton. I'm a board-certified adult psychiatrist, and I talk a lot on this app about the importance of providing full informed consent when starting a psychiatric medication, as well as concepts of safety prescribing when clinically appropriate. And I've been going through a series where each day I talk about one of our most commonly prescribed psychiatric medications, and I go through the informed consent process as I would with one of my patients. So today we're talking about Ambien. So Ambien is a Z drug, which is used primarily for insomnia, and it is supposed to be used short-term for insomnia. That's what it's FDA approved for. That being said, a lot of people end up using this medication long-term. Like a benzodiazepine, it's also going to act through the GABA receptors, but the Z drugs are more selective. And so the idea is that they would have fewer side effects and be less likely to cause things like dependence than the benzodiazepines. They also have a shorter duration of action. So the thought is that they're less likely to cause a hangover effect the next morning. However, they also have unique risks of complex sleep disorders, things like sleepwalking, night eating, night terrors. And although they're supposed to be less likely to cause things like dependence, tolerance, and withdrawal, they certainly are still causing these things. A lot of patients find they can't sleep without them, and getting off of them can be quite difficult. Like benzodiazepines, we're not going to recommend their use in the elderly population due to cognitive issues and fall risk. Other common side effects include things like drowsiness, difficulty with coordination, unusual dreams, headache, nausea, vomiting, diarrhea, stuffy nose, dry mouth, and muscle aches. There can also sometimes be mental health side effects, things like worsening mood, anxiety, confusion, or even psychotic symptoms like hearing or seeing things. Like other sedatives, it's going to cause shallow breathing, which can be an issue for people who have pre-existing respiratory conditions. Sometimes it can also impair people's ability to drive safely the next day. And like I said, when it comes to getting off these medications, it can be quite difficult. We're going to recommend the same hyperbolic taper approach that we would with antidepressants and benzodiazepines. And the longer you take a medication like this, the more challenging it can be to get off of. I don't generally start Ambien for sleep unless a patient is already on it or they tell me this is the only thing that has ever worked for me and we've tried other things and they haven't worked. I don't see the risks as terribly different from long-term use of benzodiazepines. If there's another psychiatric medication that you want to hear me go through the informed consent process for, then please share in the comments below. I'm also putting together an email list for those of you who are interested in my content because I may have future courses or resources or offerings and I want to be able to share those directly with you all. So if that's you, send me a DM with your email and I'll see you in the next one.